So I want to present a typology of what I see as 3 different types of quote-unquote trauma policies. And I don't intend for this to be an exhaustive list in any way, but it's something I have found useful in thinking about what types of policies can help translate research about trauma and adversity into policy. So first are what I would consider to be trauma preventive policies. So these are policies that aren't necessarily designed with the explicit intent of addressing traumatic stress. These policies might not mention trauma or adversity in any way, but they have tremendous potential to address trauma and adversity by reducing exposure to trauma and by promoting resilience. So this would be kind of analogous to primordial or primary prevention in the public health language. So examples of this would be policies that prevent gun violence, prevent motor vehicle accidents, prevent sexual assault, prevent child abuse, promote social support, promote income security, support early childhood development. All of these policies could say nothing about trauma. Trauma couldn't be brought up at all in the policy discourse, but still these policies are probably the policies that would have the greatest impact on traumatic stress by really going upstream. Next are what I would consider to be trauma-informed policies. And these are policies like the ones I just showed in our study of federal legislative proposals. So these are policies that explicitly mention the idea of trauma-informed practice and reflect knowledge about the prevalence of trauma exposure in a population and how the effects of trauma exposure could have secondary consequences. So this is kind of like secondary prevention. So here, examples would be policies that require an organization's staff to participate in trauma-informed trainings in order to receive federal funds, policies that regulate the behavior of attorneys in criminal cases. This was actually one of the policy proposals introduced in U.S. Congress. And also policies that require oversight and review by a panel of trauma experts. Experts in quotes because historically experts have really meant kind of clinicians and researchers, and we all know that there are many more sorts of expert, but some sort of stakeholder panel to provide review and oversight from a trauma-informed perspective. And lastly, and most narrowly, what I would consider to be trauma-specific policies. So these would be policies that promote access, interventions that mitigate the effects of trauma exposure and promote recovery. So these are really services and kind of aligned with tertiary prevention. So these would be policies that would provide reimbursement for trauma-focused treatments, policies that incentivize mental health providers with training in trauma-focused treatments to practice in underserved areas such as low-income urban or rural communities, or policies that mandate screening for trauma symptoms and referral to treatment. So just to recap this typology, so trauma preventive policies, those being the ones that reduce exposure to trauma and enhance resilience, trauma-informed policies that mitigate the impacts of trauma, and trauma-specific policies that enhance access to trauma-focused services.